Hello, good afternoon. Today I am going to discuss the topic 2 of transculture in nursing module. That is culturally based health and illness beliefs and practices across the lifespan. Um, Here we are going to discuss about cultural beliefs and practices related to health and illnesses throughout the lifespan. As you know, culture cannot separate from human lives. It affects from childbearing to older age. Um, you know that during pregnancy and delivery, different cultures practice different rituals. Um, and not only during childbearing and pregnancy, but also during adolescence, adulthood, and elderly stages also we have to practice some cultural rituals. So culture does not stand alone. Anatomy, physiology of human body, the biological aspects, that means genes, socio-demographics, and the environment do play a part in cultural practices. Rejection or undermining one's culture may result in total refusal of medical treatment. So, for example, if someone believes God's curse is the reason for some diseases, these people may not seek medical treatment. So that's why they go for traditional healers like in Sri Lanka, traditional healers like Kattalia and all. So now we will see how culture involves in childbearing. So childbearing stage ranges from conceiving, pregnancy, giving birth, including birthing process and postpartum period. Childbearing age starts from menarche and ends at menopause. So childbearing stage is a stage of transition. You know that a woman or a man, when they become parents, they have different roles and different responsibilities. So it is a stage of transition of roles and responsibilities. Not only the changes in roles and responsibilities, but there are psychological and physiological changes also. And there are some changes in societal relationship. So this you know that during pregnancy a woman cannot do some work that she did earlier. So she has to depend on others for these works, especially towards at the end of the towards the third trimester, because of this physical discomforts. She needs help from others to do some work that she did earlier independently. So this is a transition from the feelings of autonomy to the dependency and self-confidence. And not only that, during the childbirth, during the labor, the woman feel anxiety and fear. And finally, it turns to the feeling of care and bonding with the new baby after the delivery. So this is a transition period. This transition period varies across cultures. because they have different cultural values and beliefs during the childbearing period. So let's see what's the relationship between culture and pregnancy. So this conception is depend on the woman's decision. She has to decide when to get pregnant and how to get pregnant, and this pregnancy may be planned or unplanned. So if the woman plans, she is preparing for her new roles and responsibilities. But when there is unplanned pregnancies, those unplanned pregnancies happens due to forced actions like rape. So in this case, the woman has not prepared for the upcoming roles and responsibilities. So when we take birth control, so it also depend on the cultures. Different cultures believe different cultures have different roles, different beliefs regarding birth control. So some cultures allows for birth control, while some cultures are not. Some cultures prohibited, like Muslim culture, they prohibit the birth control. They are not allowing for birth control. But some cultures, they believe that it's a choice of God, and that need no interference. That means they encourage birth control. So there are two aspects related to pregnancy when we consider the pregnancy. There are two aspects: the cultural variations and biological variations. So when we take biological variations, it is mostly related to the genes. So there are some genetic diseases that caused uh, to a specific cultural groups, like sickle cell diseases. Most Africans are prone to most Africans get this disease. So um, when it comes to pregnancy, they have to think about that. And cultural variations depends on lifestyle choices and support systems, cultural beliefs, food taboos, and cravings. When we take pregnancy, so there are some cultural beliefs, food taboos related to pregnancy. Those beliefs and taboos are different from culture to culture. So when we take Sri Lankan culture, so they believe that especially when we take food taboos, they don't allow for hot food like pineapple, tomatoes, and the prawns. They consider this food as hot food, and they are not allowing during pregnancy. And there are certain actions that are prohibited in some cultures during antenatal period, not only for the woman but also for the man also. Some cultures, they do not allow for slaughtering animals. And when we take our culture, Sri Lankan culture, um, uh, we don't allow for the cleaning cobwebs and repairing houses during this antenatal period. And there are a lot of food taboos, as I mentioned earlier. So you have to find out what are the other actions prohibited in other cultures, and what are the food taboos and cravings exist in other cultures. So for that you have to read a lot. So you can find out the research articles or the articles that mention about culture and pregnancy. So when we take prenatal care, uh, so it is also different among different cultures. Some prefer traditional care while others prefer modern care, but most of people prefer traditional care, modern care with traditional care. So when we take traditional care, so these traditional people, they consider the pregnancy as a normal physiological state and a state that is not require special attention or special care. So they do daily work and until the end of the pregnancy. So but people who looks modern care, they go for medical treatment, medical attention. And but most of the cultures, we can see, they use both traditional and modern care. While they are engaged with modern care, they look for traditional care also. So this traditional care is provided by a person who is knowledgeable about the pregnancy and who has experience with those events. So in our ancient culture, the person who is called as Vinnabu, she provide this care. But at present, most women look for modern care. So, traditional care is more holistic when significant others, the family, and even the community are actively involved in traditional care. All the family members and other community are actively involved, but in modern care, for modern care, we need a trained person like medical or nursing person. Uh, when we take when we consider about care providers, some cultures, like especially Muslim culture, they prefer female care providers. So when you are caring for or a woman, such as Muslim culture or other culture who prefer female care providers, you have to think about that. So and then when we talk about the celebration during pregnancy, so some cultures, they celebrate this as they consider this pregnancy as a celebrating event. So um, but in Sri Lanka, actually, Sinhala culture, we don't celebrate that much. But if you have seen in films in Indian culture, they celebrate pregnancy. All the relatives together with that lady, they celebrate the pregnancy. So when we talk about the discomforts during pregnancy, most women in most cultures, they look for home remedies and the herbals for relieve discomforts. Okay. And not only the pregnancy or the antenatal period, but also the delivery process is also involved with some cultural practices. So for most of the cultures, giving birth is an achievement. So uh, Although the physiological process of birth and delivery is universal, the beliefs and the experience of labor and delivery may be vary across cultures. So the place of birth may be different from culture to culture. It should be decided by the woman. The place may be a hospital, may be a birthing center, may be home. Some prefer home deliveries. So sometimes this may not be a problem if the pregnant woman is very healthy, but it may be a concern. The home deliveries, it may be a concern when there is a problem with the mother and the baby. So um, some women prefer uh, presence of her family uh, during the labor, but some are not. uh, So when we take different birth positions, some cultures they prefer to sit in a birth chair. Some prefer to do the deliveries in the water, inside the water. Some prefer squatting position, so it's uh, depend on the culture. And so when we take the perception of pain during the birth, some culture they don't show this pain through their patients. They try to bear the pain, but uh, the some cultures they actually express the feeling of pain, uh, and not only the delivery, the postpartum care also varies depend on cultures. So some cultures they consider the pregnancy as a hot state, and during the labor process, this heat of this body is low. So during the postpartum care, they try to retain the heat of the body further, so they don't allow the postpartum woman to bath about 30 days, especially in Chinese culture. They practice this. They don't allow for bathing for 30 days after the delivery, because they believe that if the woman baths, the heat of the body will lose. So, and they encourage some hot food like ginger during the postpartum period. Um, so there are some food taboos also during postpartum period. So you have to find out what are those prohibitions, taboos, and what are those practices during pregnancy and the delivery and postpartum period. So you have to read. Uh, then we have to consider about the child rearing also. In some, so child rearing is also very depend on the cultures. So in some cultures the uh, parents encourage parents hope the autonomy of children. Parents expect autonomy of their children during their early childhood. Um, so, like in Anglo-American culture, they promote independence of their children during early ages, but in Asian cultures, like in Sri Lanka, Japanese culture, they rear children until they find a career or until they get married. um, so yeah, so this is rearing children is depend varies on different cultures, and child attachment is linked to the cultural variation in parenting, socialization, values, beliefs, and life experiences, and urbanization. Um, so when we take the breastfeeding, this is also varies among cultures. So this decision making of breastfeeding influenced by the knowledge about breastfeeding and other cultural beliefs and support systems the woman has. Likewise, so decision making about breastfeeding also depend on various factors. So and some cultures promote breastfeeding until um, few years, and some are not, and some encourage showing food for young children um, in early ages, but this can be a mean for uh, transferring infections. So we have to think about that. And mm when we take sleep also, uh, most cultures they uh, do bed sharing between parents and young infants up to school age, which improves bonding and which improves sleep for both child and parent, and which facilitate breastfeeding and comfort. So now we'll look at the adolescence period. So this is a teenage period which is a process of uh, growing to adulthood, and this period involves socialization, cultivation of sense of belonging to a group in terms of clothing that you know that this is the period where they look for their own identity, and uh, uh, in this during this period they uh, they are not only belongs to their cultural groups of their parents, but they belongs to their own cultural groups which has their own values and beliefs, uh, and during this age several factors influence the growth and development of the child. um, Now we see about the adulthood. So adulthood is a time of gradual physical and psychological changes. There are two main changes occur: physiological changes and psychological changes. Physiological development and psychological development is there. So we take physiological development. So during adulthood, you can see the uh, actually the growth and develop changes in the growth and development of a person, and the changes of the mentality, psychological status. So uh, de- uh, so developmental transition of adulthood can be classified into four groups. So first one is accomplishing career. You know that during adulthood period, these adults try to find out a job which has a good salary, and they try to retain in that job. Then in this period, the second is attaining social responsibilities. So during this paper, you know that they find out job when they get into they married, so they have they look after children. So they with the marriage and having children, they have different responsibilities, the personal responsibilities towards their family, as well as social responsibilities. So they have to their roles and responsibilities also changing. And again, then marriage and raising children, as I told earlier, with the marriage and raising children, their responsibilities will change. And the fourth one is modifying roles and relationships. As I told earlier, their roles and relationships with the family members and other people in the community will change. So during adulthood. So now we'll look at the elderly period. So this is the old age is the destination of lifespan. So living condition is one of the concern for the elderly, family and healthcare providers. You know that most of these elderly people, they prefer to live in their own homes when they get older, and they try to be independent. So but it is okay if they have no health problems, but the people with health problems, if they willing to live alone or live in their own home without children, it may be a problem. So they have to seek the help from others, especially from their children. Mm, So, following are some of the factors to be considered by nurses when dealing with elderly from the immigrant groups. You know that some people, they go from one country to another country at their elderly stage. So, when as nurses, when you take care of them, you have to consider about their religious identity and ethnic background. So. Um, Most of the elderly people like to engage in their religious activities during elderly period. So you have to think about, then you have to allow those practices, and duration of time living as immigrant and the degree of acculturation. Then, and that means if the immigrant has um, if the immigrant recently immigrate to that particular country, there's no time to adapt to that particular culture. So they view all the things according to their own culture they were born. So you take care in of those people, you have to think about that, and you have to allow their cultural practices as much as possible, and you have to think about the network with people in the country of origin. You have to allow them to maintain this relationship with the people in the country of origin. And then you have to think about the bond with ethnic, social, and the institution, and distances from immediate family. So, and that can be that can lead to psychological problems. So you have, when you take care of them, you have to um, give your care as family member. So This is about, and finally we talk about the roles of healthcare providers in culture care, so or transcultural nursing. So healthcare providers need to develop a network with families to ensure that both modern care and traditional care work without conflict. So sometimes this uh, modern care and traditional care can lead to conflicts, because some healthcare providers, they allow for traditional care while doing modern care, but some may criticize those traditional care. But as a nurse who is providing transcultural care and who have knowledge about transcultural care, they allow for this traditional care while providing modern care. That's best practice, I think. And so nursing is universal, but the approach to providing care differs from one culture to another. So um, so when you taking care of patients in different cultures, you have to do a cultural assessment before you're taking care of those patients. So you have to think about their culture thoroughly. You have to do a cultural assessment, uh, and you should not be judgmental. So if you are a good nurse, if you have good knowledge about transcultural nursing, you will be consider their culture, and you will allow for these cultural practices while providing the modern care. Okay, so you have to think about that when you are providing care for the patients from different cultures. So there are some links that you can get some idea about cultural practices during pregnancy and childbearing and postpartum period. So you can go through these articles and have good idea about different cultural practices during pregnancy, childbearing, and um, postpartum care. So if you have any questions, so um, you can ask from uh, any academic in the department. So thank you.